CNA exam practice test. Question number 1. Many elderly residents lose their appetite due to A. A decrease in saliva. B. Hardening of the arteries. C. Decrease in number of taste buds. D. Both A and C. The correct answer is C. Decrease in number of taste buds. Medications, head injuries, allergies, cancer, respiratory infections, Alzheimer's disease, and Parkinson's disease can all impair a patient's sense of taste. Question number 2. The thinning of the fatty layer under the skin could cause the resident to A. Lose their appetite. B. Have difficulty walking. C. Develop pressure sores. D. Have slowed mental responses. The correct answer is C. Develop pressure sores. Bed sores, also called pressure ulcers and decubitus ulcers, are injuries to skin and underlying tissue resulting from prolonged pressure on the skin. Bed sores most often develop on skin that covers bony areas of the body, such as the heels, ankles, hips and tailbone. Question number 3. Elderly residents sometimes appear stooped over and like they have lost height. This is due to A. The resident's increased difficulty in breathing. B. The deterioration of muscle tissue. C. Loss of calcium, changes in the spinal column. D. Decreased cardiac output. The correct answer is C. Loss of calcium, causing changes in the spinal column. Once bones have been weakened by calcium loss, a patient might have signs and symptoms that include back pain, loss of height over time, a stooped posture, and a bone that breaks more easily. Question number 4. One of the major reasons the elderly person is incontinent of urine is A. They are too weak to go to the bathroom. B. They can't get a nurse aide to help them to the bathroom. C. The circulatory system is failing. D. The muscle that keeps urine in the bladder weakens. The correct answer is D. The muscle that keeps urine in the bladder weakens. Question number 5. Constipation and indigestion can be result from A. Slowed respirations. B. Slowed mental response. C. Slowed peristalsis. D. Slowed brain waves. The correct answer is C. Slowed peristalsis. Peristalsis is a fancy word for the process that moves food through the digestive system. Delayed or slower bowel movements can be caused by a lack of water, fiber, or exercise. Question number 6. Strokes are seen in the elderly. Strokes are best described as A. When the muscles die. B. When the brain is deprived of oxygen. C. When the heart fails. D. When the lungs fill with fluid. The correct answer is B. When the brain is deprived of oxygen. A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. As a result, brain cells begin to die in minutes. A stroke is a medical emergency, and prompt treatment is crucial. Question number 7. Which statement is true concerning sexuality in the elderly? A. Sex and intimacy are not important. B. Elderly women are not interested in sex. C. The elderly men and women are attracted to each other. D. Elderly people are only interested in their health. The correct answer is C. The elderly men and women are attracted to each other. The desire for intimacy does not decrease with age, and there is no age at which intimacy, including physical intimacy, is inappropriate. Question number 8. One of the major causes of depression in the elderly is A. Loss of independence. B. Going to nursing home activities. C. Living with their children. D. Lack of money. The correct answer is A. Loss of independence. A loss of independence and dignity can sometimes cause depression in elderly patients. Question number 9. Which of the following statements about aging is true? A. Most elderly people are confused. B. Most older people live in nursing homes. C. Most older people are alert and oriented. D. Most older people are sick and helpless. The correct answer is C. Most older people are alert and oriented. To assess a patient's orientation, first determine if the person is awake, alert, and oriented, times 3, to person, place, and time. The assessment involves asking the patient to repeat his own full name, his present location, and today's date. Question number 10. When dry, hard stool fills the rectum and will not pass, it is called A. Edema. B. Incontinence. C. Atrophy. D. Impaction. The correct answer is D. Impaction. Fecal impaction can occur due to chronic constipation. Impaction is a significant problem for those who are bedridden due to chronic disease. Question number 11. A sitting or semi-setting position with the head of the bed elevated is called A. Prone, B. Supine, C. Lateral, D. Fowler's. The correct answer is D. Fowler's. The Fowler's position is considered the best position for lung expansion, eating, digestion, and elimination. Question number 12. Which of the following statements about nursing home admissions is false? A. Most families prefer to care for elderly relatives at home. B. Some elderly people are unsafe at home. C. Most people prefer to put elderly relatives in a long-term care facility. D. Family members may be unable to care for elderly relatives at home. The correct answer is C. Most people prefer to put elderly relatives in a long-term care facility is a false statement. Many families care for their aging relatives at home. Living in their own home affords elderly people the opportunity to age in place and to live in a familiar environment. Question number 13. Wasting or a decrease in the size of a muscle is called A. decubitus, B. atrophy, C. impaction, D. edema. The correct answer is B. Atrophy is the partial or complete wasting away of a part of the body. Causes of atrophy include lack of exercise, poor nourishment, poor circulation, and hormonal changes. Question number 14. A confused resident tells you there is a monster in the closet. The nurse aide should A. Pretend to kill the monster in the closet. B. Tell the resident there are no such things as monsters. C. Open the closet and show the resident nothing is there. D. Tell the resident you will take the monster home with you. The correct answer is C. Open the closet and show the resident that nothing is there. Verify the truth. If a patient insists that they see a monster in the closet, make sure that no one or nothing is actually in the closet. Then alter the environment. Rearrange furniture, turn on night lights, and make any other changes that might interrupt the hallucinations. Question number 15. All of the following are clues to aggressive behavior except A. Clenched jaw, B. Depressed mood, C. Pacing, D. Rocking. The correct answer is B. Depressed mood is not a sign of aggression. Indicators of possible violence or aggressive behavior include speaking loudly, yelling, swearing, clenched fists, heavy breathing, pacing, agitation, and a terrified look signifying fear and high anxiety. Question number 16. The primary reason for combative behavior in a resident is A. Anger and fear, B. Confusion, C. The resident is evil, D. Stubbornness. The correct answer is A. Anger and fear. Aggression is rarely directed at the individual caregiver but is usually a mechanism the resident uses to communicate a need, want, or desire when they cannot articulate this verbally. In addition to staff, residents may also be aggressive toward other residents. Question number 17. Hospice specializes in the care of persons who are A. on Medicare, B. chronically ill, C. on Medicaid, D. terminally ill. The correct answer is D. Terminally ill. Hospice provides care to those who have a terminal, or life-limiting illnesses. It includes physical, psychosocial, and spiritual care, for both the person dying, and their family. Question number 18. Which of the following is a proper way to correct an error in charting? A. Scribble it out with several lines. B. Erase it completely. C. Use correction fluid. D. Draw a single line through it. The correct answer is D. Draw a single line through it. When an error is made in a medical record entry, proper error correction procedures must be followed. Draw a line through entry, then pen line. Make sure that the inaccurate information is still legible. Initial and date the entry. Question number 19. Headaches, nausea and pain would be called A. Symptoms, B. Observations, C. Charting, D. Recording. The correct answer is A. Symptoms. Symptoms refer to the feelings and concerns that you feel. Symptoms can be perceived only by the person who is experiencing them. For instance, shortness of breath is a sensation that only the sufferer can feel. Question number 20. The patient, Mr. Troy, calls the nurse aide by the name of his son, who died several